Rotarians and guests, it is Wednesday. It is 12:15, and that can mean only one thing, and that it is a great day to be a Rotarian. However, it is not a great day to be someone who has seasonal allergies. Can I get an amen from the afflicted? Amen. So pardon me while I snot, snort, and sneeze through today's program. I know that's not a delightful way to welcome you, but nonetheless, welcome to the Rotary Club of York. I am your allergic president, Aaron Jacobs. And for those of you, for whatever reason or another, don't know this about me, I am a ferocious Rotarian, doing my best to live out service above self because, like you, I know I am part of something that's bigger than myself. And you can't really live out service above self if you don't follow the four-way test. Mike, would you indulge us, please? Drum roll. One more. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? I can't say enough how much it warms my heart to hear our membership unite in this common core belief because you know what? We're not always going to agree on everything, and that's something I know to be true as president of this club. But when we agree on the four-way test, our relationship transcends whatever would divide us, and we are doing a great job. Speaking of great relationships and great Rotarians, we have a fantastic trio to kick off our program today. Past President Jackie Summers will be leading our invocation. Larry Richardson will announce our visitor introductions. And don't forget our opening song, God Bless America, and the Pledge of Allegiance, led by a Rotarian who, as always, needs no introduction.
Courtney, thank you so much for ending this reign. Rotarians, please join me. God bless America, land that I love. Stand beside her and guide her through the night with a light from above. From the mountains to the prairies, to the oceans wide with foam. God bless America, my home, sweet home. God bless America, my home, sweet home. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Allergies.
For those who don't know who that was, that's Cal Weary, and he is our president's closest friend. Just so in case you were wondering why I was dissing him. Could you please join me in a word of prayer? God of wisdom and grace, we give you thanks for this day and this time together. We're grateful for the opportunities you've made known to us to render service above self. Help us to be mindful of the enduring values of life, focusing our efforts on doing all we can to lay a meaningful path for the common good and for future generations. Please bless our speaker and grant her the resources required to faithfully serve the Commonwealth, shining a light on the well-being of our citizens and providing provision for the many services under her direction. We're thankful for her leadership and commitment to human services, doing all she and her team can to ensure Pennsylvanians are equipped to lead safe, healthy, and productive lives. Thank you for this food and for those who have prepared it. May it strengthen us in body and mind. And now to you we commend this time in honor and praise. Amen.
So I'm pleased to have the honor of introducing our guests for today's meetings. Quite a long list today, but when I do call your name, please stand and remain standing until President Aaron has welcomed you. Polly Stetler, guest of our speaker. Steve Stetler, guest of our speaker. Catherine Stetler, guest of our speaker. Michelle DiNicola, guest of our speaker. Rinda Pignac, guest of our speaker. Jada Richardson, guest of Tom Donnelly. Danica Chilton, guest of Tom Donnelly. Robert Riley, guest of Victoria Diamond. Amy Jansky, guest of Jane Schuessler. Kevin Sissick, guest of Jane Schuessler. Greg Miller, guest of past President Jackie Summers. Reese Neff, guest of Leanne Wilson. Olivia Miles, guest of past President Di Hershey. Alexandria Rogue, guest of past President Di Hershey. Jaleese Seidel, guest of past President Di Hershey. And Ashley Garcia, guest of past President Di Hershey. Todd Hess, guest of Mike Osherman. Matt Kahn, guest of Thomas Cowter Jerome. Shane Rohrbaugh, guest of Glenn Smith. Tanya Stauffer, guest of Julie Wheeler. Bob Bacon, guest of Bob Borden. Valerie Reeser, guest of Chad Myers. Alex Sardi, guest of Chad Myers. And Julie Parthry, guest of past President Rob Bowen.
I think it's a good sign when I see Greg Miller, Bob Bacon, and Bob Riley, all former members of our club, sniffing back around. And Kevin, I heard your excuses for not joining our club, and I'll give you this. They were good excuses. However, they're not good enough. So Jane and Mike, I expect you to work on Kevin, and I need him a member by June 29th. Got it. So the guests we have each week is an important part of me for the program, because when I see great visitors like these, that tells me our club is doing an excellent job providing an awesome experience every Wednesday, and we are inviting our friends to see what it's all about. My friends, you will find us to be the whole package of food, fellowship, fun, and just downright good people. And you can consider me the Uncle Sam of Rotary, because I want you, Kevin, to be a York Rotarians. Rotarians, help me welcome our guests today. Thanks, guys. Is Kate Newland here today? Kate, stand up for just 2 seconds so people can see you. Okay, I'm embarrassing Kate. Sorry. I want to give her a quick kudos. She's one of our newest members who recently posted and boasted on behalf of our Rotary Club on Facebook with some very kind words, as well as spreading the message about our clubs with our new yard signs. And Kate, I am so glad that you are having such a positive experience with our club. You are now officially an outstanding true Rotarian. Good job. On a more somber note, I wish to express on behalf of our club condolences to another new member, Letice Brown, on the death of her father the last week. Please keep Letice and her family in your thoughts and prayers. On to committee announcements. The Investment Committee will meet immediately following this program today here at CCY in the Mixed Grill. The Preserve Planet Earth Committee will meet this coming Wednesday, May 8th, 8 a.m. via Zoom. And the RCY Board of Directors will meet May 9th at 8 a.m. via Zoom as well. Friday is a big night for a lot of reasons. May 3rd is going to be a big day, especially for our club. It's going to be a super big day because that's our ribbon cutting ceremony for Continental Square. This Friday evening at 8 a.m., we are inviting all Rotarians and community members to join us in Continental Square to celebrate this service project. And I think at this point, we can all agree with the publicity we got that this had a tremendous impact on our downtown community. Most of you are going to be downtown anyway, whether it's for First Friday or Give Local York. So please take a break around 8 o'clock, meet up with us all at the square and do the ribbon cutting together. Now, speaking of Give Local York, I'd like to invite Dan May and Phil Woods to the podium to give an announcement. Dan and Phil. Oh, just.
So I'm going to go out on a limb and think this might be the last public reminder that Give Local York starts tomorrow. So unless you just recently moved to York, or if you are my brother-in-law who's lived in York his entire life and has never heard of Give Local York, tomorrow at 9 p.m. is when the entire York community will come together and raise money for our local nonprofits over a 24-hour period. So I want to take a brief moment and remind everybody about the importance of the stretch pool. So the stretch pool is a pool of funds that have been raised that will be shared by all participating nonprofits who receive donations during Give Local York. And this is the important part because there was a change last year. So the stretch pool funds will be distributed based on the number of unique donors to each organization rather than dollars raised. For example, the more of us that individually give to the Rotary Club of York during Give Local York, the more funds our club will receive from the stretch pool. So this is your last call to action to support your favorite local nonprofits in our community, such as the Rotary Club, starting tomorrow at 9 p.m. Thank you.
One thing that Lynn requested in the budget for this year was a shock bracelet for myself for when I make mistakes at the podium. So apparently I said 8 a.m. this Friday, the first mistake finally of my year. It's 8 p.m. So if you get there 8 a.m., just camp out a little bit. We'll be there. Otherwise, we look forward to a good turnout for Give Local York this week to support all the good causes that our club is doing. On to the next part of our agenda. Being a Rotary singer is such an important role in our weekly meetings, and I know there are plenty of our members who could join this team of angelic voices. And to talk more about this group, I would again like to invite a Rotarian who gets no introduction.
The abuse. So on days like today, when the pollen count is extremely high, and I know I'm pretty stuffy, it would be wonderful to say that we have a few more people out there who I can call on to sing instead of me as a member of the Rotary Singers. Now, as you know, we are going to be absorbed into a bigger group later, but the Rotary Singers will not go away. So if you are a virtuoso or even virtuoso, we'd love to have you as a part of our Rotary Singers group. We can always use more. That just means that I will go up less times and that some other folks will, but we would love to have you. If you are interested, just reach out to Lynn or myself and we will put you on the list. Is that good enough? Thank you very much. Good singing.
And now I'd like to invite past President Josh George to the podium to introduce our newest members to the club. Josh.
Thank you, President Aaron. Good afternoon, ladies and gentlemen, guests, past members. Today, I would like to introduce you to two new members to our club. And for our past members, take note, one of our new members is also a past member. So the three of you need to be back up here sometime soon.
What he said.
And I'm just trying to get this done for Aaron by the end of June because Courtney doesn't need any help getting new members.
I always get to follow.
So without further ado, we'll start with Robin Rohrbaugh. Robin is a graduate of Hanover High School, went on to Shippensburg University to earn her Bachelor of Arts in Social Work, and then earned her Master's in Social Work from the University of Maryland at Baltimore. She is the president and CEO of the Community Progress Council, and she's very active in the community. She's a board member for the Community Action Association of PA, a past board member for the YCEA, past board member for the White Rose Leadership Institute, and also for Planned Parenthood of Central PA. Her hobbies include travel, gardening, and reading historical fiction. And as I said, she was a past member of this club from 2013 to 2019. She is proposed for membership by Joe Iandola. Robin Rohrbaugh, ladies and gentlemen. And next we have Jasmine Simpson, who I affectionately know as Jasmine Byers because I knew her before she got married 20 plus years ago when we were both on the board of Dollars for Scholars together. She's a graduate of William Penn High School and went on to York College, where she earned her bachelor and master's degree in education and was a YCOSP scholarship student. She now works at HAC, where she serves as the associate dean in the School of Public Service. Her community service includes she is a board member and the secretary of Dollars for Scholars. Now, she's been on the board of Dollars for Scholars for about 20 years, give or take. Yeah, that's a long, I did about 5 years. That's awesome that you're doing 20. Yeah, it's awesome. She's a task force member for the Workforce Echo, and she's a committee member of the K-12 school counseling program at the York City School District. Her hobbies include spending time with her family, volleyball, basketball, reading, and I really like this one, backgammon. So if you have any backgammon players in the club, she's the one to talk to. She's married to Ronald, and they have two kids, Xander, who is 20, and Riley, who is 4. And she is proposed for membership by Tom Donnelly. Ladies and gentlemen, Jasmine Byers Simpson.
Friends, Rotary is all about reciprocity. It's all about how we help one another and work together, not for our own sake, but for the sake of others. The Rotary Club of York will not fail you when you are engaged. Speaking from a personal perspective, I've always believed this club has done more for me, both personally and professionally, than any other organization in my entire life. And I have every expectation that you will have the same experience. And to swing back around to our visitors today, these new members were guests like you at one point this year and decided to take action and make a good decision. I hope to see our visitors on the stage like this before July 1st, Courtney and Josh. Let us welcome our new members today. Thank you. Not that anyone's counting, but the number as it is right now is 297. I am told we have a few in the pipeline to get us oh so close to 300. So any one of you who are guests today could be number 300 if you can get this done in 2 months, Kevin. He just doesn't stop, does he? Speaking of people who don't stop, I'd like to introduce Tom Donnelly to the podium to introduce today's program. Tom.
Good afternoon, Rotarians. Good afternoon, Rotarians. Thank you very much. Aaron isn't the only one with a loud mouth here. It is such a pleasure for me to welcome Valerie Arkoosh, MD, Pennsylvania's Secretary of Human Services to our Rotary podium. Governor Josh Shapiro relies on Val Arkoosh to handle the biggest of jobs, and the Department of Human Services is Pennsylvania government's biggest agency. The department administers more than $50 billion in Medicaid, medical care for lower-income Pennsylvanians, including children who receive coverage through Obamacare, long-term care for the elderly, and direct care for the disabled. All in all, the Department of Human Services serves more than 3.5 million people. Dr. Arkoosh succeeded Josh Shapiro as Montgomery County Chairman in 2017, becoming the first woman in that role. Hear, hear. During her service on the commission, Montgomery County thrived economically, as it continues to do so as Pennsylvania's third largest county, and had the most favorable bond rating in the county's history. Arkoosh brings a physician's caring heart and a prevention-driven attitude to her job leading DHS. She recognizes that DHS must innovate and be efficient, facilitating and funding healthcare for society's most vulnerable people in a time of unsustainable federal budget deficits. Prior to stepping into public service, Secretary Arkoosh was professor of clinical anesthesiology, obstetrics, and gynecology, all three of them, Val, at the Perelman School of Medicine of the University of Pennsylvania. Her undergraduate degree is in economics from Northwestern University. Val grew up in Omaha, Nebraska. She is married to Jeff, who has been a friend of mine for more than 50 years, and they have 3 adult children. All are fascinating, highly effective people who I enjoy as my neighbors at Pocono Lake Preserve. I admire Val as a trailblazer in her public service and literally at Pocono, where she and Jeff clear our trails. I want Val Arkoosh to be my doctor. Since I can't have that, I am glad that she is my Secretary of Human Services. Please welcome Secretary Val Arkoosh.
Well, good afternoon, everybody. That was quite an introduction, Tom. Thank you so much. I really appreciate it. It's such an honor to be here with all of you. And Tom left one thing out of my biography, but there was really no way for him to know this. My dad was a Rotarian, and this was such an important organization to him. Yep, you can give Dad some applause. I'm sure he can hear you up in heaven. And I still remember very clearly as a child, you know, he just would not miss a meeting because that's a thing, right? You can only miss so many meetings. And so even on vacation, I can remember he would make sure to find where a meeting was and he would do his best to get there. So I'm always so honored and just really feel grateful to have an opportunity to speak to a group of Rotarians, and very appreciative of the work that you do here in the Commonwealth and of course around our world. So thank you. It's really great to be here. And President Aaron, it sounds like you've got some people nipping at your heels and maybe some people pushing you. I don't know. I can't quite figure out what's going on here, but I hope we can help him get to those 300 members by July 1st. So that would be pretty great. So good luck with that. So I just wanted to touch on a couple different things with you today, and we'll see how I do on the time here. But I'm going to try to move pretty quickly through a number of things, and then I'd be eager to take your questions. I'm going to talk a little bit about some of the principles that guide my work at the Pennsylvania Department of Human Services, an overview of some initiatives that I think will be transformative for folks here in the Commonwealth, and a bit about my rather unusual background, which you got just a little snippet of from Tom's introduction. And I practice medicine. As you heard, I served as a county commissioner, and I do want to just give a shout out to my former colleague, President Commissioner Julie Wheeler. Thank you so much for being here. And as DHS secretary now, and also as a mom to 3 kids, I've had the opportunity to learn a lot over the years about leadership, collaboration, building community. But I wouldn't be where I am without what I learned and experienced through my medical and public health educations and the time that I spent teaching others and taking care of patients. There are lessons that these are lessons that continue to expand and evolve. And I've been honored to bring what I've learned so far in my career to the Department of Human Services. And one of the most important things that I've learned is the power of sharing stories. And I'd like to share one with you that illustrates kind of a primary principle that guides my work. And it is a story about 3 friends who are walking in the woods. And they are approaching a river. And as they get closer, they hear children screaming, and they're not really sure what's happening. And they get up to the riverbank and they see that this river is full of children who are just being swept downstream. And they can see in the distance that there's a waterfall, and these kids are really, really in trouble. So one of the friends jumps into the river and swims out and grabs a child and swims back to the riverbank. The second friend pauses for a couple of minutes and ties some logs together, kind of makes a little raft and goes out and gets maybe 2 or 3 children at a time. And thankfully, after a little bit of time, the number of children in the river starts to slow down, and then it stops. And it's at this point that the 2 friends look up and realize their third friend is nowhere to be seen. And they're kind of annoyed because they've been working pretty hard. And shortly after that, their third friend comes walking down the riverbank and they say, "Where have you been?" And that friend says, "Well, I walked upstream to see why these kids were in the river in the first place and to see if I could stop it." So when we think about problem solving, we're often taught to jump into that river, right? Certainly as a physician, I was trained to intervene in the moment in an emergency to treat a patient's problem that was right there in front of me. And obviously that's extremely important and something that we must continue to do. But sometimes before we can really move ahead, we do need to think about what got us to this moment in the first place. And I'm sure that this is the type of problem solving that many of you use every day as you think about how to grow your business or to solve a problem. So I'm very focused in this work on thinking about how do we prevent many of the problems that are before us? How can we take something that's relatively small and easy to solve and solve it in that moment before it escalates into something much bigger and much more difficult to solve? We must meet people where they are and address their most urgent needs. It's a big part of what we do here at the Department of Human Services, but our work can't stop there. We must look upstream. The Department of Human Services, as you heard, serves more than 3.5 million people directly through programs like Medicaid, SNAP, Child Care Works, and others that we administer. This represents more than 27% of the Commonwealth's 13 million residents. And through other services, we touch the lives of millions more. It's hard to find someone who isn't touched in some way by our work. We are a vast agency spanning healthcare, income maintenance, long-term care, child welfare and juvenile justice, disability services, behavioral health, licensing, and more. This gives us countless opportunities to hopefully make a positive impact, and we must consider how needs and challenges look different along a person's lifespan. Our work is a direct investment in the quality of life and opportunity for all Pennsylvanians, and it's a work that myself and my team take very, very seriously. As you know, many communities in our Commonwealth have been effectively treading water or heading toward that waterfall for a while now, facing growing challenges to stability and the opportunity to live healthy lives with the dignity that we all deserve. Strong communities across Pennsylvania form the foundation of a resilient and economically thriving Commonwealth. And investments in Department of Human Services and supports allow more people to have the opportunity to be a part of that vibrant future. The DHS's work begins with enabling stability, but this should not be where our work ends. The programs we administer provide access to basic needs like healthcare and food and shelter. These programs are a vital first step and an essential investment in individual dignity and well-being of the people that we serve. But we're also committed to using the resources and tools at our disposal to build bridges to success so that each person that we serve has the opportunity to chart the course of their life and the way that defines success for them. I strongly believe that we must actively and intentionally use our reach and service to help prevent and correct disparities, inequities, and structural barriers that place and keep people in poverty and in poor health. This is something that we can't do alone. To truly be successful in these goals, we must listen to and learn from the people living and working in the communities that we serve. We can and regularly do look at data from DHS programs to identify trends and themes. For example, our more rural counties often have a higher percentage of their populations covered by Medicaid compared with other parts of the Commonwealth. Erie, Luzerne, Cameron, and Fayette have at least 30% of county residents covered by Medicaid. Here in York County, at least 1 in 5 people get their health care through Medicaid. And rural counties in Pennsylvania have a higher concentration of families with young children living in poverty. There are 13 counties in Pennsylvania where at least 20% of families with children under 5 live in poverty. Every single one of them is considered a rural county. In Cameron County, the county with the highest percentage, 39.5% of families with children under 5 live in poverty. I believe that these numbers are unacceptable. They are indicative of the many ways that our systems and society have failed individuals and families living in communities around our Commonwealth. The statistics must be a call to action for all of us. If we're going to have a chance to be truly impactful, make interventions that really matter, not only do we have to pay attention to the data, but we must also listen to community members and partners and advocates and providers who know firsthand where and what the needs are and what has worked, and just as importantly, what has been tried and not worked, and what the opportunities are to strengthen how we can help individuals and communities build a foundation for stability and success. To approach this work in any other way would be short-sighted. DHS regularly engages with advisory councils for our programs that include people receiving benefits and services, healthcare providers, payers in managed care, advocates, and others to understand how our programs are working and how we can strengthen our programs and services. And advocacy and listening to our partners and people with lived experience play a big role in making some of the initiatives that we're pursuing as part of our current budget cycle possible. Governor Shapiro's budget seeks to make a historic investment in programs serving Pennsylvanians with intellectual disabilities and autism. And I want to just give a shout out to Greg from Penmar. I know you were in this room. You said hello to me when I came in. We visited there a few weeks ago, and what an incredible operation that they have there. And we're so grateful to have them as a provider here in York County. If you're unfamiliar with this system of care, Medicaid covers home and community-based services that help people with intellectual disabilities live safely and independently. These services assist with tasks of daily living, therapeutic supports, and provide opportunities for engagement and participation in their community through volunteering, learning, and work. Historically, these services have never been funded in a way that allows everyone who qualifies to receive the right services at the right time. We and most other states in the United States maintain a waiting list for these services. Providers and advocates have fought for years for more, and it's time that we move away from the current practice. Our system of care and the dedicated professionals who serve Pennsylvanians with disabilities are and should be a bridge to successful everyday lives that every person deserves. The governor's proposed budget starts a multi-year growth strategy to expand access to home and community-based services and effectively end the emergency waiting list for adults by increasing capacity within our waiver programs and investing in rates for service providers. We cannot improve access to services without also supporting the people who provide those services. That care and the support that direct support professionals are at the heart of, and we must recognize their commitment and their work. I can stand here and explain to you the impact of these numbers and tell you that how transformative these investments will be if the General Assembly passes this budget. But who is really at the heart of this are the advocates who've been fighting for these investments for decades. Parents and siblings and caretakers, direct support professionals who aid and assist people with disabilities every single day. These individuals and families are the reasons why we're able to pursue these investments. Their years of advocacy on behalf of themselves, their loved ones, and their community got us to this point to make a significant investment to do better. Their voices and advocacy made this possible, and I truly hope we're able to get this to the finish line and take this step together. And before I go on to some other budget initiatives, I just want to make sure that you all know that Representative Carol Hill Evans couldn't be here today, but she sent Danica Chilton from her office. So if you like some of the things that I just said or I'm going to say next, please let the representative know. Additionally, this year's budget seeks to increase reimbursement rates paid to child care providers who participate in Child Care Works, which is our subsidized child care program. This program eases affordability for lower-income working parents by subsidizing the cost of childcare, helping them to navigate the access barrier that could otherwise prevent them from building a career and a better future for their families. Providers who participate are paid a base rate per child from the state. This rate is set as a portion of private pay market rates in that community or that region. 5 years ago, our base rate was about one quarter of the private pay market rate, obviously unacceptably low. Today, we're reimbursing at 65% of private pay. Better, but still not great. If Governor Shapiro's budget passes as proposed, this will increase to 75% of those private pay market rates. This would bring Pennsylvania to the federal government's expected benchmark for rates and help close that gap between private pay and subsidized care, providing operational supports to providers who serve our lower income working families. This commitment allows Child Care Works providers to invest in quality of care and their workforce amid the continued challenges of operating in the current economic climate. When we target support toward rates paid for subsidized care, we invest in equity and opportunity for all children served by our child care workforce. We cannot sustain a vibrant economy without also strengthening the child care infrastructure. I'm hopeful that this continued investment will provide more support to this essential field, and the child care workforce that does so much for our children will continue to thrive. A report published by the United States Senate Committee on Small Business and Entrepreneurship cites data that an estimated 90% of child care businesses are owned by women, with more than half being owned by women of color. Child care is largely a small and locally owned and operated industry. When we invest in the people and the small businesses who do this important work, we are investing directly in our communities. Beyond these, thank you. Beyond this, I'd also like to share with you an exciting and transformative project that is separate from the current budget process that the Department of Human Services is hoping to undertake beginning sometime in the next year. We are in the process of pursuing additional interventions through our Medicaid program to further our ability to support vulnerable Pennsylvanians through various points in their lives. Research has found that social determinants of health, that's things like food and housing and transportation, account for 50% of geographic variations in health outcomes, compared to clinical care, which, and this always pains me as a doctor to say this, which accounts for only 20%, a very important 20%, but still, those social determinants count for 50%. These health-related social needs, like stable housing, consistent access to nutritious foods, social supports, a safe community, and more, can shape a person's success in education, in the workforce, health across their lifespan, and their children's health and well-being. Looking beyond just the urgent need to the broader causes and stressors that influences people's health gives us the opportunity to get ahead of health concerns or make more sustainable interventions upstream. We must not miss clear opportunities to identify challenges and potential solutions. The Center for Medicare and Medicaid Services allows states to tailor their Medicaid programs to help meet these health-related social needs through a process known as an 1115 waiver. We hope to take full advantage of this opportunity and work with the General Assembly to improve the lives of Pennsylvanians and reverse trends that are detrimental to their health, well-being, and overall quality of life. Our proposal spans 4 areas of focus: housing, nutrition and food as medicine, reentry supports, and multi-year continuous coverage for children through age 6. Being safely housed can reduce hospitalizations, avoidable emergency department visits, and incarceration rates. A study on the impact of housing supports on Medicaid spending in Oregon found that housing supports reduced an individual's Medicaid spending by 12 to 16%. Think that what that could mean across those 3.5 million individuals in our Medicaid program. To realize a similar impact in Pennsylvania, my team has designed programs to expand housing and tenancy supports like short-term rental assistance and social and emotional support to help people stay housed and reduce evictions. Data from during the pandemic found that nearly 1 in 4 Medicaid households were food insecure, and women and people of color were more likely to experience food insecurity. Nutrition deficiencies and food insecurity can have a lasting impact on a person's health, ability to succeed in school and in the workforce, leading to broader societal costs and chronic health risks. We may be able to slow or prevent these issues by making healthy, nutrient-rich foods more accessible to people who don't have an affordable grocery store with fresh fruits and vegetables readily accessible. And these programs very explicitly try to work with local farmer communities to bring fresh fruits and vegetables locally grown to the individuals that are being served in these programs. The Department of Human Services is seeking to expand coverage for medically tailored meals, grocery deliveries, and other nutrition supports for pregnant or postpartum people experiencing food insecurity, newly diagnosed diabetics, and others with health conditions where the proper food is essential to managing their disease. These interventions that can help entire families and give children and youth the foundation for healthy growth and habits throughout their lifetimes. We're also seeking to better support the health needs of individuals who are returning to their communities after a period of incarceration. 2/3 of incarcerated people have a history of a substance use disorder. These individuals are 12 times more likely to die from overdose shortly after release and are 3.5 more times likely to die in the long term. But we know that these deaths are preventable. Justice-involved individuals deserve health care and support to help with the transition back to their homes and communities. It's critical to them and to their families. And lastly, we want to encourage regular use of preventive and well child visits and avoid disruptions in care by providing multi-year continuous coverage for Medicaid-eligible children through age 6. As you all know, early screenings and interventions and preventive care to address physical, behavioral, and developmental health needs leads to better outcomes through adolescence and into adulthood. This investment in uninterrupted access to care for children will have a lifelong impact. When we look at these young children, we see that many of their parents have seasonal employment. And so they go in and out of healthcare coverage. And so if we can keep that coverage steady, it'll help create the foundation for these kids to have long and healthy lives. So the Department of Human Services submitted our 1115 waiver application, which we call Bridges to Success, Keystones of Health, to the Centers for Medicare and Medicaid Services. The full application is available on our website at dhs.pa.gov. And further, there's all kinds of details and further information about these plans if you're interested in learning more. If approved by CMS, we will then work with the General Assembly to implement what we are able to do with CMS's partnership to broaden the resources that DHS and our partners have available to help Pennsylvanians achieve stability and success. So as I mentioned at the beginning, I just want to spend a few brief moments sharing a little bit very quickly about my professional journey and how I went from practicing medicine to standing here in front of you. And I will connect the dots back to my larger remarks here, I promise. I can say with certainty that I wouldn't be in my current role or with you here today if it weren't for my time practicing medicine, both what I was able to treat, but perhaps more importantly, what I was unable to change through my work as a physician. As you heard, I came into public service by way of medicine first, and then public health. As a physician practicing in Philadelphia teaching hospitals, I saw the health of my patients impacted by so many things that were outside of the exam room. I regularly bore witness to the impact of generational poverty, perpetuated by economic disenfranchisement and poverty wages, and exacerbated by challenges like racism and biases and gun violence. To be healthy, so many of my patients needed stable housing in a safe neighborhood, clean air to breathe and clean water to drink, or simply that grocery store in their neighborhood that they could get to that sold fresh fruits and vegetables. And as a doctor, I could not write a prescription for any of those things. These experiences began a shift in my perspective on my work. I could help treat that immediate issue, that child in the river that was in front of me. But when the illness was caused by or added to by these other external factors, I quickly learned that I couldn't cure the disease. These structural factors will not go away overnight, but they motivated me to start asking, how can I do better? How can I be part of bringing the solutions that my patients really need and our communities really deserved to the table? As I said earlier, so much of medicine is doing what we absolutely must to help a person stabilize, meet their most urgent needs, and start to chart a path forward. But while this is necessary, this is just the first step. I realized that I wasn't content working only on the urgent issues. I became interested in how I could be part of working upstream. I fundamentally believe that the opportunity to live a vibrant, healthy, and enriching life is something that should not be a privilege based on the zip code in which you live or social identities. I wanted to broaden my focus and be part of the essential work to reduce and eliminate the barriers to good health for my patients and so many others. This desire for change took me back to school to learn about public health policy. I got my master's in public health from Johns Hopkins while I was still practicing medicine. One of the most important things that I came to understand was the role that advocacy plays in developing public policy. While earning my degree, I was inspired to find and use my voice. This led me to join the National Physicians Alliance, where I advocated for healthcare reform and promoted public engagement from physicians at the national level in the run-up to what became the Affordable Care Act. And while there's still so much more to do in health policy, it's incredible to see the impact that our voices and advocacy have had. I see it every day in my work. This is why Keystones of Health and the Department of Human Services work to forge bridges to success for people served by our programs is so important to me. It's an opportunity to make the impact to help people achieve stability that I just couldn't do practicing medicine. I eventually ran for office, as you heard, served for 8 years as a county commissioner in Montgomery County before being asked by Governor Shapiro to serve as secretary in the Department of Human Services. But if you care and are able and want to contribute to making positive change in your committee, as I'm sure many of you do, that is part of the mission of Rotary. Being an advocate does not require that you run for office or take some of these huge leaps like I have. Really, what it means is just get involved in your communities. And this is my real plea to you. You can write an op-ed. You can speak to your elected officials at all levels of government. Participate in professional or issue-based advocacy organizations. Engage in research efforts, or just talk to your personal networks and share your experiences and your expertise. There's no one way to accomplish this, but I hope that you will make your voices heard. We're at a really critical juncture in our country now, and we need to talk to each other. We need to listen to one another, and we need to understand where lots of different viewpoints are coming from. And I hope that organizations like Rotary and all of you in this room together can make a commitment to do that type of advocacy. So when we harness our collective passions, we're going to increase our impact, and we're going to move the ball forward for the Pennsylvanians that we are all so passionate in serving. So thank you again. It's really been an honor to be here with all of you today, and I am happy to take questions. Thank you.
Thank you for your presentation. There's a question that's been gnawing at me throughout your entire talk. The third friend that went up the river. No, in all seriousness, how does the Commonwealth rank in the nation in terms of the Department of Health and Human Services? And
Well,
what metrics do you use to rank?
yeah, so I can't really give you a national ranking because our Department of Human Services is very different than many other states, the way that we're configured. We actually, I've been told I lead the largest state agency in the United States because we have so many things within our agency. Many states, for instance, the Medicaid program is a standalone sort of agency. But what I can tell you is that the metrics that we use are many of the things that I touched on as we look forward towards how can we continue to make things better for Pennsylvanians. We look at access to healthcare. We look at numbers of people that are unhoused, people that identify as being food insecure. Some of these really fundamental things that we know are critical to maintaining health. We're also keeping a very close eye on things like childcare. We know we have enormous workforce issues in our Commonwealth right now. And part of the challenge remains post-COVID, we have parents that would like to go back to work, but they don't have a place that's safe and affordable for them, for their child to be while they're at work. And so we just are constantly evaluating these metrics in a whole host of different ways. And we regularly meet and review everything from how long does it take for one of our folks to answer the phone, which is often too long, and I will readily acknowledge that we are working on that, to a whole host of other things. Does that get to the answer? Yeah, thank you.
Hi. Speaking of metrics.
Yeah.
If the governor's budget were to pass as proposed, how many more state residents would you be able to provide services to than you are currently providing services to?
Yeah.
And secondly, do you consider your department's success simply to grow the number of people receiving services? Or to what extent do you seek to help people establish independence where they no longer need services? And do you measure that?
Yeah. So great questions. So if the governor's budget were to pass as proposed, in my particular area, we would see a number of children, we believe, able to get childcare that currently can't because we don't have enough childcare providers able to hire enough staff. In the program that serves individuals with intellectual disabilities and autism that I mentioned, there is a wait list of about a little over 6,000 adults who are on an emergency waiting list. And if this budget gets enacted as proposed over the next several years, we'll be able to end that waiting list. So that will, it's not going to all happen in the first year, but over the next, we hope 5 to 6 years, maybe 7, we'll be able to end that waiting list. There is money in the budget to provide more services so that individuals remain housed and don't lose their homes. There's dollars for eviction prevention and some rental assistance and stabilization that we believe could help on the order of 2,500 to 3,000 people. So I'm just giving you some touch points here to give you a sense of the kind of impact that that we're talking about. And there's, you know, many other pieces of it. In terms of our vision at DHS, we have a core mission of providing stability for people that currently are in situations that are not stable. But every day we talk about building those bridges to success. And that's a big part of what this waiver program is about that I told you, that we want to create those opportunities, make sure, help a family achieve stability, make sure they have access to affordable childcare so they can go to work. We are part of a number of programs for job training that help. We work with community colleges and other community-based organizations on job training initiatives that make it able for someone to get training while still having the ability to feed their family, because that's often a real tension for these families. So absolutely, my goal is to help people get stable so they are then able to take that next step and achieve independence.
How many success in your view?
You know, it's hard to answer that definitively because the population of our Commonwealth is evolving. You know, we see a lot more older Pennsylvanians that are actually retiring. I would love to see more young people moving to our Commonwealth. So it's hard to say, you know, X number of people. We don't really think about it in terms of, you know, trying to get X number of people into a certain place. It's really creating the opportunities for folks to move forward. And over time, the hope would be that incomes would rise and that there would be fewer individuals that would qualify for some of the services that we offer. One step that would help us get there would be to raise the minimum wage in the Commonwealth. The governor's proposed a $15 increase in the minimum wage to $15 per hour. And just to put that into some context, we believe there's 900,000 people in the Commonwealth that would benefit from who currently have a wage lower than $15 per hour. And of those 900,000, about 85% are between the ages of 19 and 65. So we have a lot of our working adult population that is making less than $15 an hour. That alone would help actually move people forward in a very substantial way. Does that help? Did I get enough detail? Yeah. Okay.
Right here. So we hear a lot about mental and behavioral health challenges in our society. And as an employer, I see it to a great degree in my younger workforce. I mean, as an employer, it feels very real among my employees. From your perspective, where you sit, what does that look like? And to what degree, if any, do you have a role at your agency in helping address those issues going forward?
Well, we see it very, very prominently in our work. I see it as a physician. I see it from when I was a county commissioner and now, of course, as secretary. So within my agency is the Office of Mental Health and Substance Abuse Services. And so this is another big part of our work. The governor's budget has a number of really important proposals. One is to increase the amount of what's called base funding that our counties receive. Our counties are absolutely key to providing mental health services, behavioral health services in our communities. They can help people who don't have good enough insurance or any insurance. They work with community partners. They are really like at the center of this behavioral health work in our counties. There are dollars to help our schools. I think we all understand that our youth have really been through it the last few years, and that the more that we can co-locate services and supports in schools to, again, provide these services early on before these certain behaviors or other challenges become, you know, kind of built into that particular individual, we can really have much more of an impact. So this is work that's being done across multiple agencies. We work with the Department of Education. We work with the Department of Drug and Alcohol Programs. This is something that we focus on with a great deal of energy. Yeah.
Valerie, it's abundantly clear and evident that service is embedded in both the structure and the name of the Department of Human Services. But also, DHS is by nature a service above self organization. And I'd like to think that it was your father's influence as a Rotarian that led you to apply your leadership for such an important organization. Thank you for all that you and the Department of Human Services do for our community. Keep up the good work. One more round of applause. In honor of Valerie's program today, we are donating the book, The Oldest Student by Rita Hubbard. It will be donated to the Devers Elementary School in the York City School District, along with a bookmark made by the students at Creative York. What a great program. And if you think that was a good one, wait till you hear what we have for next week, because in case you haven't noticed, there is an election on the horizon. So next week, we will welcome David McCormick, who is running to represent Pennsylvania in the U.S. Senate. David's background is marked by a distinguished career in both public service and the private sector. He is a former Army officer and has held leadership positions in finance, government, and philanthropy. He has served as the CEO of Bridgewater Associates and has worked in various roles in the federal government, including as Deputy National Security Advisor under President George W. Bush. As a candidate for U.S. Senate, David McCormick will address how he will represent the interests of all Pennsylvanians and work to create a bright future for our state and our nation. Have an amazing Rotarian week. This meeting is adjourned.